Hey guys, welcome back to Medical Coding with Blue. So, today was just one of those really weird days, and it started from yesterday. I was supposed to go to a function last night, and I said, okay, I'm gonna take a nap for about 30 minutes, and I'll just get up and then I'll be able to attend the function. I took a nap, started at 5 o'clock, didn't get up till 9:15. Completely missed the function that was supposed to be at 7. Completely missed it. But oh well. So I said, okay, I'll just whatever. I'll just I let the person know that I'm so sorry that I didn't make it. But time got away from me because I'm not going to admit I was asleep. I guess I was like really tired yesterday or something. So then I get up this morning, and of course there's a detour for traffic, and I have to be at work very early, and it's still pitch black. So I have to take this detour that I'm not used to, and who missed the road that they were supposed to go down? Me. It is pitch black, and I could not get to where I could turn around safely, and so I had to drive further up, and then it's just like by the time I could get to work, it was like 30 minutes past my start time. So if you've watched my channel already, you know I hate starting late anytime. And I think this week is just a wash. I'm really truly thinking that this week is just a wash. But I did have a couple meetings this morning. So today's topic is all about medical coders resist the urge to get complacent. That is the topic for today. And I say this because it is related to the meetings that I had. So I am very hands-on. I mean, clearly I have my own channel. You know what I mean? I do classes constantly, it seems like, but I am very hands-on. I am a very hands-on coder. And my whole thing is always this need to learn more about my craft, to learn more about the disease process, to look through the book at everything that is available for my providers and making sure that they are documenting everything so that they can get credit for everything. I know that not everybody is like this, and it shows especially when I get new providers in, and when I hear like what hospitals they're from or what organizations they were with, I can kind of gauge now like what is a level of hands-onness. I know that's not a word, but we're gonna work with it today, people, okay? Because like I said, it's just one of those days. But when I experience things like I experienced today, it just makes me want to like go to these hospitals and be like, can I be of assistance? Can I help? Is there a medical coder exchange program we can do for a little bit? Because I really think it would be helpful. So when I say resist the urge to get complacent, what I mean by that is if you are coding in a specialty clinic, let's just take specialty clinics for example, and of course this can apply to family practice, things like that. But let's just talk about specialty clinics for a moment. If you're working in a clinic like orthopedics, okay, and I'm just going to give them as an example because it is the perfect example, okay? Orthopedics covers injuries, it covers organic conditions like stuff that goes on in the body like osteoarthritis and chondromalacia, things like that. So it covers those two things. And when you have a specialty service that covers a lot, you really do have to make sure that you, the medical coder, are working towards learning as much as you can. You can't just get complacent because specialty clinics are not cookie cutter. And so they do not fall like regular straightforward stuff. This is stuff that is very detailed, and you have to be a detail-oriented person. If you are in a specialty clinic and you're not trying to actively learn something every day, you're not doing yourself or your providers any favors doing that. You have to try to learn as much as you can. And yes, maybe it is the same thing that they're doing all the time. But have you looked at the section of the book? I mean, I know a lot of us work with the encoder, but have you actually taken the time to look in the section for orthopedics, for example, or podiatry, and just really look at all of the codes that are available, whether it's diagnosis or procedures? Have you looked at articles? Have you read different books? I read the New England Journal of Medicine. I do. And even for stuff that's not related to my clinics that I code, I still read it anyway, because I try to capture as much knowledge as I can anywhere that I can. Because being a medical coder, it is a constant learning process. So when I see providers that come to me that are brand new, that didn't have this, they've never gotten this, they've heard things that were incorrect, it's hard for me, because it's like, even though we have all the same set of rules to follow as medical coders, there are some people that it's just, I don't know if they're just not trained well enough, or if they're just not paying attention. Okay, so you have to be able to pay attention, and you have to be willing to learn more as you go along. And one of the providers that I was talking to today had a resident in there, and the resident made a comment, off comment, that said, well, coding is hard. Okay. Our providers are supposed to document, and we as a medical coders, that is our job, is to code it. So we really have to try to break that stigma. And I told her, I said, it's not hard. Okay. I said, we have to break this stigma of medical coding is hard, because as soon as people start hearing medical coding is hard, and I'm not saying that medical coding is easy. Of course, it takes some time and practice and diligence to learn it. But once you learn it, then you know what to do to learn more things. So I told her, I said, it's not hard if you have somebody that can explain it to you, or explain why it is that we need certain things to be documented a particular way. So, and she's like, well, and I said, I understand. I mean, if it just depends on where you come from. I mean, if you have somebody if you're in a facility that they have very little contact with medical coders, and so the providers are just kind of doing their own thing, it's understandable that they have that sort of mentality, because they don't see the medical coders and they can't ask them questions. So they kind of have to do their own thing. But then when they get into a place that does have a hands-on coder, they're like, well, wait a minute. I didn't know this, or I have a colleague that said it's this way. If your colleague, I always tell them, if your colleague is not trained in medical coding, be sure to ask a medical coder. Because sometimes when people are looking at something and they can interpret it one way, but if you ask a medical coder, it is completely different. So just keep that in mind. If you hear a provider say something like that, they can't always trust information that is just given out, because you really have to make sure that we're double checking that information. Because as the medical coders, it is up to us to make sure that they are having everything captured like they should be. So that was my whole thing for today, was just talking about not getting complacent. And I've seen coders get complacent, and it is very hard to watch, because sometimes they just want to just do what's there and that's it, and I'm not digging for any extra information. I am just looking at this documentation and thinking, this could be documented better, or they should know this. The provider should know this, whether it is where they're at when it comes to like injury coding, if it is an initial injury code with the A at the end, or if it is a subsequent, or if it is a sequela or a follow-up. Those are things that the provider should know. And if they don't know it, then take the time to explain it to them. Because if you take the time to explain to providers what it is that you're looking at and why you select the things that you do, there's better communication. And I always talk about communication. I think that's like 90% of my videos is about communication. Because if we talk to them and they talk to us, there's some workflow going. So it just makes things easier. And if you hear somebody say coding is hard, let's try to combat that, because it is all a mental thing. If you have it in your mind that medical coding is hard, it's going to be hard. And I'm not saying that it is easy, but I am saying that we need to look at it from a different point of view. This is something that is learnable. This is something that is teachable. It's not something that you can't grasp it, because yes, you can. I have seen providers who were very steadfast in that they did not want to learn coding. They did not want to learn, not necessarily coding, but they did not want to learn why I needed to have this documented this way, or why they had to document this at all, this or that, until I kept talking to them and we started working together. And they're like, oh, this is easy. Now I get it. So I'm just saying, let's just try to break the stigma of this is hard, because no, it is learnable. It is teachable. This knowledge of medical coding is attainable. So if somebody who never went to medical school, if somebody like me can get it, trust me, if you apply yourself, you can get it. So that's just my little rant for today. Because like I said, if anything could go wrong today, it went wrong. Even when I went to lunch, the cash register went down for like 6 minutes. And I'm like, oh well. But the good news is I got a second cup of coffee, so that's all right with me. So anyway, and I totally had something planned for today, and in everything that happened, the chaos of today, I completely forgot what it was. I completely forgot what it was. But anyway, that's just my point of view today from a medical coder. So if you have any questions, if you have any comments, feel free to let me know. Thank you so much to everybody, the recent subscribers. Thank you so much. And thank you, of course, to all my subscribers. And if you haven't subscribed yet or liked this video, just consider it and give it a try. I talk about the fascinating world of medical coding, and I'm normally more informative than this, but I think today was just one of those days. Anyway, please like and subscribe, and I will see y'all on the next video. Bye.